Hello and a very warm welcome on this special episode of Living Room Conclave India Health Mission. Today we'll be looking at children's heart diseases in India. Now, heart ailments have become a major cause of worry in today's fast-paced world, and adults are not the only ones affected by it. Children too are equally vulnerable. Now in India, 1 in 100 live births is diagnosed with congenital heart disease or CHD, encompassing a range of birth defects that affects the way the heart functions. Today I am joined by a panel of experts who will dive into the causes, symptoms, trends and the latest treatment protocols being implemented for congenital heart disease and its related risk factors. Allow me to introduce my panel. We have with us Dr. Suresh Rao, Director, Children's Heart Center and Consultant, Pediatric and Congenital Heart Surgeon, Kokilaben Dhirubhai Ambani Hospital. Dr. Raja Joshi, Chairperson, Department of Pediatric Cardiac Sciences, Sir Gangaram Hospital. And Dr. Rajesh Sharma, Senior Consultant, Pediatric Cardiac Surgery at Apollo Indraprasth Hospital. Thank you, doctors. Thank you so much for joining me here. Dr. Rao, I'll start off with you. You know, according to the Indian National Library of Medicine, if we look at a birth prevalence of CHD as 9 out of 1,000, then the estimated number of children born with CHD in India is more than 2 lakh per year. That's a sizable number. But what are the major causes and the symptoms of CHD?
To be honest with you, we don't know one cause of congenital heart disease. But we do know that it has got some genetic basis, you know. I mean, if I can tell you, it is something wrong with the operating system when the heart is developing. So you keep seeing varieties, but same types of lesions in many children. So obviously there has to be something, but as yet we don't know. But then there are some syndromes which are associated with heart problems, and those are something which we can tell you about. But the exact cause we don't know.
So, do you think that, you know, children with Down syndrome, would they be more vulnerable?
That's one of the syndromes we know which is associated with heart problems.
Okay.
There's a specific type of heart problems called atrioventricular septal defects. That's the most common with Down syndrome.
We'll of course discuss this a lot more, but Dr. Sharma, I'll come to you now. So, you know, if a child has CHD, is he or she at more risk of developing life-threatening complications during the initial years, or do the symptoms come up in adulthood?
So there are many types of congenital heart diseases or defects. Some of them are critical, and as soon as the baby is born, then, you know, if a structure called the PDA closes, which remains open in the fetus but tends to close when you're born, and a particular circulation like the lung circulation or the body circulation is dependent on that, then the child is faced with a life-threatening situation. The other situation in the child is very blue because of a mixing problem and is living on the same structure called the PDA, and once the PDA starts to close, as soon as the child is born, then they get into become very blue, and there's a serious risk to life. So there are various types of defects. There are other defects which present later on in life. They will present some months down the road. Some present some years down the road. But in general, if you do an echo early on in life or in fetal life, they can all be picked up, whether they are going to be symptomatic or asymptomatic.
Dr. Joshi, I'll come to you now. So, you know, again, research reveals that, you know, around the estimated number of children that are born with CHD, 1/5 are likely to have serious defects requiring an intervention in the first year of life. Now, while India's medical infrastructure, medical systems have improved over the years, but still, you know, such level of advanced cardiac care is available only to a minority number of children. How can the medical fraternity, how can the government step in to help extend this further to the needy?
That's a very important and pertinent question in today's progressive India. The first thing I'd like to say is that, let me give you a little brief of what I think science has done till now for children of congenital heart disease. There's stupendous improvement in the outcomes, if you put it that way. So we know how to treat these problems if they come to us in time. That is the most important statement. They need to come to centers which are sort of collectively ready to handle these critical children, especially in the first 3-4 months of life. The problems, say when the cardiac surgery was born, the outcomes were as dismal as 35 to 40% mortality, and now we can confidently say that we can save most of these children. Mortality figures overall are less than 5%. So that means outcomes are there to be taken. Vis-a-vis, if you look at how the infant mortality rate in India has gone, also stupendously improved. In 1950s it was 189 per thousand, now it's barely 30. The challenge is to bring this 30 down will need a focused sort of directional planned movement of attacking congenital heart disease. Why? Because from bringing it down from a number like nearly 200 to 30, the problem was mainly infectious disease, prematurity, and these probably now have been tackled, and we are seeing the success in the numbers coming down from nearly 200 to 30. So like the last few pounds are the most difficult to get rid of, the reduction of mortality rate in infants from 30 downwards will need a concerted effort towards congenital heart disease being tackled, or defects which are since birth. They need to be tackled in a very planned manner, if you put it that way. So how government can come on forward? It's trying its best. How private players can come forward, they are also trying their best, but they are not joining hands. I think that's where we are we need more, how do you put it, coordination?
Dr. Rao, just moving this conversation ahead, one hurdle always becomes is the cost. And anything they talk about medical inflation is that does cost. Any kind of treatment, and especially something like this, is obviously going to cost. So the sad part is very often people, sell assets, home, jewelry, whatever, to pay for this. How could it be made more affordable for the people who are in need? What, from your bank of experience, what's your take on this?
One of the reasons why congenital heart surgery is costly are a lot of factors are there. One, you require some infrastructure for that. You require a good ICU, you require a good infrastructure. You require a multidisciplinary team. It is not just one person.
Yeah.
You require multiple specialties who have to work in unison to make the thing possible. A lot of equipment which we use are all imported. And India unfortunately doesn't manufacture many of these. Though we have made attempts, some progress is being made, but the bulk of it is imported. To give you an example, the suture which we use, one suture is 1,000 rupees.
Wow.
So you might be using, I don't know how many sutures of that kind, And then you have the ICU, the post-operative care, the investigations which is required, a cath lab investment. So I think if you see all this, there is certainly a cost to that. But then, having said that, we can't obviously have like what the developed countries have got. We have to have tailor it to what our population can afford. So that is where I think we need to have a mixture of private insurance,
yes,
then insurance the government insurance, just like what you have in the developed countries, UK and all these other places. But that, unfortunately, we have not been able to make much headway in that. And though we have taken baby steps to at least the BPL, the below poverty line people are sort of covered, but the middle class, I think, still there is a huge segment which pays out of pocket.
Yeah.
That is sad.
Yeah.
That's sad.
Dr. Sharma, I wanted to come to you about one point that Dr. Joshi spoke about. When they're young children who are faced by CHD, and he spoke about the need that it's really important for timely intervention. That if you're detected early, doctors can do a much better job in helping the patient. But how does any parent, if it's a child, for that parent, that child is the best in the world, and they can't even think about the fact that this child might be unwell with something like a heart disease. What's your advice to parents who are watching the show about how can they be more aware of CHD? What do they need to look out for if, God forbid, their child has CHD?
Some children later on, especially those with holes in the heart, they would have increased flow to the lungs. So they get breathless at about 3 months of age and they start breathing fast. And since breathing competes with feeding, they are not able to feed properly. So they get tired, they have sweating during feeding. And that is a pointer towards a problem. There are other children who would have a blue tinge in their nails, in their lips, or when they cry, they start turning blue. So that is another pointer, that there could be a heart problem and the child needs a further evaluation. There are yet others who will be completely asymptomatic. That means there is nothing wrong on the surface, but then only when you get a screening echo done that some defect gets picked up. So there is an entire spectrum, and the answer basically is that you should have early screening for congenital heart defects because all of them or most of them, 99% are treatable, eminently treatable, like Dr. Raja Joshi said.
Dr. Joshi, I'll take the conversation ahead to you, to the next step, which is the treatment that Dr. Sharma was also speaking about. If you could elaborate on elaborate a bit more on the treatment that one should undergo, or that doctors do suggest that a patient undergoes when they are detected with congenital heart disease.
To put things in perspective, we decided just now that we have approximately 2 lakh children who are being born with heart problems, and we definitely know that 1/5 of them are going to need intervention in the first month to 2-3 months of life. That's very early in the family's age as parents. The type of procedures that could be done after a proper evaluation and achieving a certain diagnosis would be that they will require, most of them would require some sort of open heart procedure. I'm talking about these 1/5 of those critical newborn babies who will warrant some kind of intervention. One type of intervention is undergoing open heart surgery. If I can give an example, there's a problem called transposition of great arteries, or in simple layman's language, the good blood vessel and the bad blood vessel, they are switched. Naturally, they are sort of wrongly positioned. So your body is receiving impure blood and the lung is receiving pure blood, which shouldn't be. It should be the other way around. And the operation is called arterial switch. Now, as far as timing for this surgery is concerned, it's so important that in the West, they say at 3 days of age, this patient should have the best outcome for the survival and long-term survival. On the other hand, if we go just 3 weeks down the line, there is a difference in the outcome graph that you start seeing. That means timing is of paramount importance here, and surgery has to be performed in these first 3 weeks of life to get the best out of the child. There are other procedures. Say for example, if a particular valve is sort of obstructed, that's called a pulmonary stenosis or a aortic stenosis. Then a set of procedures called cardiac cath procedures, where you insert a balloon from a groin, inflate the balloon, deflate it and bring it back, which forces this sort of shrunk valve into an open position that will help blood flow from an obstructed position into a free flow position. So these are the rough estimated procedures that for various different conditions can be offered to these critical children. Closing the holes can be done later on in life. These children will definitely be operated between 6 months to 1 year of life for sure, if they are lucky and they are detected. Not saying that they can't be operated later on, but I'm talking about the best timings for the outcome. So newborn critical patients will require something done in the first 1 month, if you put it that way. Open heart surgery versus cardiac catheterization procedures, which are commonly called as ballooning or balloon dilatation, those kind of procedures. And very gratifying, very gratifying.
Thank you for that, Dr. Joshi. That's an important insight there. Dr. Rao, now I'll come to you on, again, moving the conversation ahead. The important part of medical science is the regular innovation, the R&D that happens. New things are being discovered, invented. There is, of course, we're talking about 3D printing. It's an emerging technology. Do you see that has its time come, especially in CHD? Can it be helped there? Or in your experience, again, any new developments that you're seeing that can help this treatment reach people faster at a cost-effective manner? I mean, just wanted to know what developments are happening in this space.
Yes, we were all very excited when 3D printing came because it's always nice to have a defective heart model in front of your eyes, feel it, and then you can sort of see that. But having said that, it's good for teaching, for training, so that you get to know. But I guess for an experienced surgeon who's already got the 3D printed heart in his mind, it may be of little less value. But I'm sure for the younger surgeon who is sort of coming up, and for the juniors who are training, and it has definitely helped, certainly, yes, definitely.
Okay.
The only problem is the added cost, but I guess once you use more and more of that, it could come down,
Dr. Sharma, so we've been speaking about early diagnosis, of course, very important. But it's also said that, prompt planning plays a very important role. So how do you take care of any patient-specific pre-surgical planning? How do you guide them on that?
It is best if we diagnose the child before birth and have the mother deliver at where the center has the expertise. The other conditions which are there and which may present, a lot of the wherewithal in our country is the financial planning. Because unfortunately, even though the government has chipped in with various schemes, most of them would cover only the government sector. The few that do cover the private sector do not give enough package to cover the private or the corporate hospital package. So a lot of children go to the government centers and they are unable to be accommodated because of the huge waiting list there. They spill over to the private centers, but they are not able to afford private centers. Private health insurance does not entertain congenital conditions, strangely enough. And therefore, like the tax-paying middle class, which constitutes most of these people, the BPL get covered by government schemes, but they still end up in the waiting list in the general hospital. So that's not an ideal situation either. So these people end up paying huge costs, which are entailed in congenital surgery by pocket. And a lot of people shift from get converted into the below poverty line, just getting their children treated, which is a very sad state of affairs. So to answer your question, the planning basically is financial. So you tell a patient, your child has this condition, and this is the money involved, and that is how I can admit the patient under my care in a private hospital. The option is to go to a government hospital, and there are huge waiting list. So the poor family is trapped between these two extremes.
Dr. Joshi, the next question that I would like you to talk about, the next point that I would like you to talk about is about insurance. Dr. Sharma mentioned it, Dr. Rao also mentioned it earlier in the conversation. So I'll come to you first, Dr. Joshi, and then Dr. Rao, I'll come to you. On the insurance bit, what's your advice? How can your advice to viewers, to government bodies, to the medical fraternity, what can we do for the insurance angle? Because yes, this is a sizable expense which an everyday common Indian is not easily able to meet that expense. Just Dr. Joshi, starting with you, sir.
Encouraging policies should be made if companies can have CSR activities guided towards supporting congenital heart problems. NGOs which are ready to support such cause, they be under good scrutiny. I'm not denying that fact, but they should be encouraged from the government with some relief, so that a direction is given, so which encourages people to help.
Dr. Rao, as we wrap up, just your thoughts on the whole insurance aspect, as what Dr. Joshi has said. Just wanting you to add on to that.
Well, I think there's some progress has been made. If I'm not mistaken, 2019, the IRDI issued a circular that if you need to cover any congenital diseases which is not seen to the naked eye, you have to wait 2 years. So if the policy is in force for 2 years, they do cover. I think that's a welcome move. But then that excludes all the neonates.
Right.
Because they can't wait for 2 years.
Yeah.
So we need to find out for the neonatal cover, what are the things which could be available, either it's sort of a floater or a rider or on a health policy, or a lady when she conceives, they can take some kind of a policy that needs to be worked out,
Right.
So the other thing is the insurance is important because sometimes these children overstay for many reasons, because of the complexity of surgery. The biggest problem now is some person overshoots the package duration and all that. So that becomes another huge impact for the family. So these are the things which we need to work on and from the insurance sector. And I think world over it is there.
Yes.
The same company which is in India, in the other countries, say in UK, they do cover congenital heart surgery.
So I think it will get there. It's just, and like you said, whether it's important, but I'm sure where there's a will, there is a way, and that's again the aim of having these kind of conversations, to bring experts like you to the table to talk more about this. It's been an absolute pleasure. Thank you, Dr. Rao. Thank you, Dr. Sharma. Thank you, Dr. Joshi, for your time. It's been an absolutely thought-provoking discussion that we've had. This was a special edition of the Living Room Conclave India Health Mission. We will have many more episodes, so stay tuned to the channel for that. But today we spoke about CHD, or congenital heart disease, the importance of that, why it's out there, what are the symptoms, what can be done to treat children for that, and more importantly, what's the way ahead, what are some of the important topics that need to be addressed so that CHD, the impact of that, can be lessened. Thank you so much for watching.